my name is Courtney Whalen, and this is my persuasive speech topic. Okay, so addiction is a disease that most people tend to ignore. There are 40 million Americans, or 1 in every 7 person, ages 12 and up, who are addicted to or abuse drugs on a daily. I think that is why we should focus more on rehabilitation rather than punishment for addicts, because it has a more positive outcome in the long run. So what causes addiction? There are a lot of things that causes addiction, but the main things that are more common are past trauma that they're unable to heal from, so they use drugs as a way to escape, to cope with it, to just forget for a little bit, or mental health issues. There are some people who struggle financially, who don't have the funds to pay for like the medications, for the therapy, for the doctor's appointments, things like that. So they use drugs as a way to numb their pain, just forget a little bit, or in some cases they even self-medicate. Peer pressuring is a huge one. My dad used to always say that the people you hang around with, you're going to eventually become. I never really understood it as a kid, but I realize now that it's a very true statement. If you start hanging out around people who smoke, eventually you're going to start smoking. If you start hanging around people who drink, you're eventually going to start drinking. If you hang around people who start abusing drugs in their free time, then you're most likely going to end up using drugs in your free time and causing more problems down the road. In many cases, a lot of addicts feel a sense of hopelessness, whether it is they don't have many friends or family that help them out, that they don't really have much of a support system, they may not have a job or even a good paying job for that matter, they could be in really bad debt, they could be just really stressed out in general. So they turn to drugs as a way to get a sense of relief. They call it a false happiness that drugs give you, because anytime that you come down, you end up feeling a lot worse. So in the end, it really just causes more issues than it does help any. Since the effects of deinstitutionalization, prisons have become the new mental health institutions. 2/3 of addicts reoffend within 3 years after being released. Most addicts that end up getting arrested get arrested for drug-related charges, but as they get further into their addiction, it can cause more criminal charges, more crazy erratic behavior, and more violent crimes. Prisons use the teach them a lesson method rather than proper care and treatment. Rehabilitation gives people a chance to learn about their illness, learn about any past traumas they have, any mental illnesses they may not be aware of, and just learn about their addiction altogether. It gives them a chance to change their attitude, gives them a chance to change their environment, and just change their activities in general. It gets them help instead of just putting them in a room in prison and making them sit there by themselves all day, alone with their thoughts. Tends to do more damage than it does good. Drugs' long-term damage include damage to the immune system, damage to the heart, damage to the liver, damage to your diet, or even appetite for that matter. Without a substance, addicts tend to feel like they're dying because they have built up an immune system and basically have a dependency on the drug, and once they stop using that drug, they just feel pain all around their body, and they don't know what else to do besides just take the drug and make it all go away. A study done by Skywood says that 95% of addicts return to a substance of their choice once they get released. 60 to 80% of these commit new crimes due to either detox, lack of medication, or lack of money to go to therapy. They're not getting the help they need, so they just turn back to the only thing they know, which is drugs. The downfall with prisons is they have a lack of education about addiction as being a disease and not being a choice, and they have the lack of funds and resources to help an addict who is going through withdrawal or is going through detox or any problems like that. They're not equipped or influenced enough to know how to help them. They're just there to refrain the prisoners. They don't know. They have the nothing works mentality that, addicts will always just turn to drugs in the end, but that's not always true. If we show addicts that there is a chance to change, and we show them and we teach them ways to cope with their desires or anything like that, then there's a chance that they can move on. A study in 1988 showed that 70 to 80% use drugs before conviction. 10% go to prisons and receive treatment. 70% deal with the after effects, and release and then continue using. Rehabilitation centers like Clearview Treatment focus on learning individuals' addictions, triggers, and safety plans features when experiencing cravings, like what to do if you start experiencing a craving, like what things you can do to distract yourself, to stop yourself, and they just give you treatment, therapy sessions, and they just work with you to figure out what we need to do to stop this. They also focus on co-occurring depression, anxiety, and treat coping skills and staying sober. They are more equipped to help with detox because the body goes through withdrawals. They go through tremors, shaking. In some cases, some addicts even get sick from withdrawals. They know how to handle that appropriately and logically. Addiction is very life-threatening, and we should offer rehabilitation. There are prison-based treatments, but they are very, very rare, and only, I think it was about 11% of addicts get the treatment required in prison that they need. So I think we should all think a little bit more and have a little bit more compassion when it comes to addicts and find the root of the problem and help them, because punishment never seems to do anything for addicts. They get in and out of jail like it's nothing. Thanks for listening.